Assalamualaikum warahmatullahi wabarakatuh. Good morning to all my friends from Class C of 2020 and especially Miss Fitri. Thank you for giving us the opportunity to presenting our work. On this occasion, we are from Group 7. We'll introduce our members. Carolina Korindo, Adela Heri Prasilia Amalda, Vina Ratna Wulandari, Syahlanida Afsohriandi, Alifah Horunisa, and Selvia Wulandari.
Okay, on the first section, we will discuss about connection between the original article entitled Stressor, Coping Mechanism, and Motivation among Healthcare Workers in Dealing with Stress Due to the COVID-19 Pandemic in Indonesia, and proponent article entitled Faktor Penyebab Stres pada Tenaga Kesehatan dan Masyarakat saat Pandemi COVID-19. So, things that I can understand from the text we've discussed in the health workers are experiencing stress due to the COVID-19 pandemic. Then, after reading the proponent article, I think that strengthens and evidence from the original article that the because of stress in health workers, including examples such as increased risk of exposure, the possibility of getting infection and infection their loved ones. Fear of contagion is reasonable. Apart from a lack of supplies of personal protection equipment or PPE, in some areas, careless use of the PPE, the potential to cause virus entry. Working in the midst of media attention and public attention, the massive and long duration of work also perhaps unpredicted on multiple health professionals has the added effect of triggering negative psychological effect including emotional distress, depression, stress, low mood, irritability, panic attack, phobias, symptom, insomnia, anger, and emotional exhaustion. Then, one of the efforts that can be done to reduce pressure on health workers is to design and implement psychosocial support to reduce psychological stress. When a health crisis occurs and change in the work pressure and severe, the trauma healing program, hypnotherapy, and mentoring of psychiatrists who routinely provide psychological refresher for the health workers should consider strenuous other than curative strategies that focus on the patient's psychical healing.
Next, on this second section, we will talk about some particular segment. Health workers are at the forefront of dealing with health problems due to the COVID-19 outbreak. The reason why we found this heart-touching is because it can be said that health workers have become heroes to us for facing this pandemic situation. If we talk about the reality, actually no one dares to handle this disease except the health workers. Even so, people do not appreciate enough about their struggle by continuing to socialize or traveling outside the region, whereas the government has implemented social distancing. Of course, this will add to the existence of COVID-19. In this case, it is natural that health workers feel tired or stressed out because they have to work alternately for almost 24/7 and putting their life at stake. Therefore, together we could prevent further transmission by implementing health protocols.
On the third section, we made summary of the original article. Health workers are the frontliners who had to deal with the health problems due to COVID-19 outbreak. The requirement to use PPE every day was the most significant stressor for health workers. In this challenging time, health workers need an adequate support to increase their productivity and keep them motivated. Most commonly, strategies that used by health workers to deal with the COVID-19 outbreak were adopting a positive attitude to motivate themselves. Many factors like family support also can motivate healthcare works. If it is impossible to meet family members, then it will be the members' duty to encourage them by sending positive message. On the other hand, good collaboration between professional, effective preventive measures, and a positive attitude when dealing with the pandemic also play an important role in reducing stress.
The following sections mainly will explaining about the definitions, synonyms, and antonyms for words that we found important to understand. First, we have word stressor. It can be defined as an environmental condition or influence that stresses, i.e. causes stress for an organism. The synonyms for word stressors are nuisance, annoyance, and inconvenience. And the antonyms of word stressors are convenience, pleasures, and enjoyment. Next, we have word coping mechanism. Coping mechanism is strategies people often use in the face of stress and or trauma to help manage painful or difficult emotions. The synonyms for word coping mechanism are coping strategy, defense mechanism, and adaptation. And then the antonyms are refusal, flight, fight, and nonconformity. Next, we have word pandemic. Pandemic is a disease that affects a wide geographical area and a large proportion of the population. And then we have the synonyms for word pandemics are epidemic, endemic, and plague. And the antonyms are local, specific, and partial. Next, we have word volunteers. Volunteers can be defined as one who enters into or offers for any services of their own free will, especially when done without pay. The synonyms for word volunteers are helpers, unpaid worker, and the antonyms is non-participant. Next, we have word ethical obligation. Ethical obligation is things a person must or should do based on a code of ethics. For this word, we couldn't find the exact synonyms or antonyms. And the next word is personal protective equipment. Personal protective equipment is equipment worn to minimize exposure to hazards that cause serious workplace injuries and illnesses. We couldn't find the exact synonyms or antonyms. And the next word is frontline. Frontline can be defined as most advanced or important. The synonyms is for front and the antonyms is mediocre. For the last word is adequate. Adequate can be defined as equal to or fulfilling some requirement. The synonyms for word adequate are sufficient, enough, and passable, and the antonyms are inadequate, deficient, and insufficient.
After this presentation, there will be a lot of questions that may rise from the viewer's mind. Therefore, we made a list of questions that mostly include the core of the original article. Here are some examples. Number one, what kind of positive attitudes the affect healthcare workers for keeping them motivated? Number two, what do you think about the discrimination towards the frontliners like healthcare workers? Number three, what action has the Indonesian government taken to provide assistance to healthcare workers?
I think that's enough for our presentation. We would like to apologize if there's any mistakes. Thank you so much for your attention. Wassalamualaikum warahmatullahi wabarakatuh.